Hi everybody, Dr. Nikki back here to answer all your questions about pee, poop, and sex. I have gotten so many emails from you guys and I am so grateful for that. So thank you so much for reaching out, and it's an honor to be able to help. A lot of the emails that have been coming through have been about pelvic pain, especially after giving birth. So for all you ladies postpartum, this video is just for you. Having a baby is a really, really big deal, and a lot of people don't take into consideration the toll it takes on your mind, your body, and your spirit. And so I want to go over a couple of pointers for you if you are suffering with pelvic pain or pain with intercourse since you've had your baby. So first off, let's take a look at your birth. Was it a cesarean section or was it a vaginal birth? If it was a vaginal birth, was there a long duration? Did it take 3 days to get that kid out of you? Did you have any tearing? Did you have an episiotomy? Did they have to use forceps or a vacuum? All of those things are going to go into delaying the healing process. So if you think about it, if you had a cut or a surgery anywhere else in your body, it would take some time to heal. Now, the unfortunate part about having an injury in the pelvis is that you have all these organs involved in there, and it takes a lot of time. Plus, your pelvis is the center of your whole core. So it's not like you can really give your core a break, especially if you're taking care of a child. You still have to get in and out of bed, get in and out of a chair, get on and off of the couch, carry that little tyke around. So these are all demands that are put on your core that could delay the healing process a little bit. But here are some pointers to help get you through it. First, relax. Having a kid and being a new mom can be really stressful. And in response to that stress, majority of us brace. We brace our abdomen, we brace our glutes, we kind of just tense up and get ready for the war, so to speak. But all of that tension is really only going to delay the healing process because it impedes the blood flow in and out of your pelvis. And we want blood flow because it brings in all the goods like oxygen and it takes away all of the bad. So really focusing on relaxing your belly, relaxing your hips, and allowing the healing process to ensue is step one. Step two is tuning into your pelvic floor. The pelvic floor are also known as your Kegel muscles. So they're the muscles that contract when you have to hold in pee or gas. They're also the muscles that relax when it's time to pee or poop or fart. So most often, especially if you've had some tearing or an episiotomy with stitches, those muscles are probably going to be kind of tense, just like any other muscle would if it was cut into. So focusing on your pelvic floor and being able to contract and relax equally is huge. Majority of women that I see postpartum have contracted tight pelvic floor muscles, which is totally acceptable because of what your body just went through. But those tight pelvic floor muscles are not really gonna work best for you. I talk about that in my ebook, The Kegel Cure, which is, the link is available at the bottom. So go ahead and download that. It's free and it'll teach you all about how muscles work best when they start from a relaxed position. So with your pelvic floor muscles, if they are in a contracted or tight position, they're not going to work well for you. For one, to help with bowel and bladder control. But also if you're having pain, a tight muscle kind of it allows that pain cycle to continue and could cause more pain. A, because it's preventing the blood flow from coming in and out, but B, it's also stimulating your whole nervous system, which is responsible for pain in the first place. So in addition to relaxing your belly and your hips, see if you can contract and relax your pelvic floor muscles gently, not doing a bunch of hard, strong Kegels and holding them for forever, for 10 seconds or 20 seconds or a minute like a lot of other programs say. Because if you're contracting a tight muscle, sometimes you could be feeding that tightness, feeding that contracted state, and that's counterintuitive. Lastly, if those things aren't working for you, I highly suggest that you seek out a pelvic floor physical therapist in your area. I'm a pelvic floor physical therapist in San Diego, and it would be an honor to work with you if you were here. But if you're not, go online and Google search pelvic floor physical therapy and maybe your zip code and see what is out there. There is help. You do not have to do this all on your own. And of course, if you have any questions about me, my services, or this video, reach out to me. My email is nikki@theorganicpt.com. That's nikki@theorganicpt.com. I hope this video helped, and I wish you the best in healing your pelvic pain.